Hi everyone, I'm Dr. Brian Foley, your alternative doctor, and we're going to talk about neuropathy today. Now I know you've been told there's nothing you can do to fix neuropathy. That's absolutely and totally false. But let's go through what neuropathy actually is. It can involve your feet, it can involve your hands. Mainly in the feet is what we get in our office. Peripheral nerves, these are nerves that are coming out of the spine and into your hands and feet. You're going to get some symptoms like numbness, tingling, loss of balance when it gets bad. Your feet can no longer communicate to the brain and you don't know where they're going and you lose your balance. Burning, pain, this could be sharp pain, dull pain, achy pain, pain during activities. If you're out being active, walking, running, and then your feet are achy or burning at the end of that, that could be neuropathy. Muscle weakness, feeling like you're wearing gloves or socks. So this would be like you have a rolled up sock under your foot. It feels like that, but there is no sock rolled up under your foot. When the autonomic nervous system, now that's part of your nervous system that you don't have to think about, like your heart beating, digesting food. When that gets involved, now you start having heat intolerance. You can't tolerate heat anymore. Excessive sweating. Change in blood pressure. Your blood pressure may suddenly go up or slowly go up over time. And it can affect one or more nerves in your body, can be affected by this. So those are the symptoms of neuropathy. Now we're going to go over what causes neuropathy. Okay, so we're going to talk about the causes of neuropathy. And guess what the biggest cause of neuropathy actually is? Unknown. It just happens. Nobody knows why and what causes it. Chemotherapy. 80% of the people that go through chemo will have neuropathy at the end of their chemo treatment. Diabetes, blood sugar problems will cause neuropathy. Sugar tears up the nerves in the feet. Autoimmune. If you have an autoimmune disease like Hashimoto's or any of the other ones, you're a potential to have neuropathy in the long run. Infections. Here's some other causes. Alcoholism or excessive alcohol drinking. Heavy metals. Now we find heavy metals in almost everyone that comes into our office. Medications. There are actual medications that will cause neuropathy. Vitamin deficiency like vitamin B1, B6, B12 will all cause neuropathy if they're deficient long enough over a long period of time. And then, of course, trauma to the hands or feet can also cause neuropathy. Okay, so we're going to go over what is actually going on in the hands and feet when you do get neuropathy. There's nerves in your hands and feet, obviously, and there's two types of nerves. You have large fiber nerves and you have small. The small fiber nerves are the ones that give you the pain. The large gives you that numbness, tingling, and all that weird sensations. But here's what also happens is that you have capillaries that start to break down, and it's called microvascularization. And what happens over a period of time is they start to break down and the nerves no longer can get the nutrition. So this is a nerve, and this is demonstrating how these capillaries, which are very, very small arteries, and they're nourishing the nerve, start to break down. Well, then the nerve impulse can't get through there. So a lot of times you might have been told if you have neuropathy that the nerves are dead. They're really not dead. What they are is they went into a coma. And the treatment that we do at our office actually wakes them up and heals them up. We also have, that can happen along with the capillaries, is depolarization. Your nerves are very electrical. So they have a positive and a negative charge. And what happens is that positive and negative charge can no longer cross over and you have no charge or depolarization of that nerve. And you get no feelings. If you have no feelings, then that can lead to loss of balance. It can lead to pain, numbness, all that stuff we went over earlier. So this is what's happening, and this is what we reverse when we actually do our treatment. The nice thing about our treatment is that 90% of it is actually done at home. So there's some home therapy that you have to do, and there's a few things in the office that you have to do, but we've been able to reverse neuropathy, and we have a 90 to 95% success rate doing that. And I'll see you on the next video.